Western Aphasia Battery Revised by Alex Dolan and Carrie Volkar. Ryan Gilchrist is a 28.1-year-old male who presents with severe expressive language disorder characterized by non-fluent effortful speech, reduced length of utterance, telegraphic speech, anomia, phonemic and semantic paraphasias, use of filler words, impaired repetition, difficulty reading aloud and writing. A mild receptive language disorder characterized by difficulty comprehending complex utterances and reduced reading comprehension. Ryan also has a severe articulation disorder characterized by right side hemiparesis or weakness, apraxic speech characteristics, articulatory groping, unintelligible speech, difficulty initiating speech, impaired motor planning of speech sounds, and difficulty sequencing speech sounds. Ryan has suffered from several heart problems since his youth, including heart arrhythmia, hypertension, and congestive heart failure. On February 13, 2006, Ryan sustained a head injury during a fall, resulting in a hemorrhagic cerebrovascular accident. In January of 2007, Ryan was diagnosed with severe expressive aphasia and apraxia of speech at Euclid Hospital. He has difficulty with gross and fine motor movements. Ryan was a graduate of Orange High School and prior to his CVA had completed some college at Cleveland State University. He was living alone and working as a mortgage loan officer for Chase Bank. He also is a professional gospel singer and composer. Currently, Ryan resides with his mother, Mary Gilchrist. He is unable to communicate independently, but he is able to self-care and cook and clean. After reviewing the case history, clinicians decided to administer the Western Aphasia Battery Revised, which has subtests for all modalities of language, apraxia of speech evaluation, and a bedside screener for a subacute inpatient evaluation. The Western Aphasia Battery Revised diagnoses a specific type of aphasia based on the locationalist theory, Broca's versus Wernicke's, based on the specific lesion locale, whereas the Minnesota Test of Differential Diagnosis of Aphasia does not diagnose based on lesion locale since it comes from the holistic theory of aphasia diagnosis, meaning all modalities being affected to some degree. The Western Aphasia Battery was designed to evaluate the function of language in an individual following a stroke, dementia, or other acquired neurological disease. The purpose of the Western Aphasia Battery is to determine the presence, severity, and type of aphasia, to measure the patient's level of performance to provide a baseline for detecting any change over time, to provide a comprehensive assessment of the patient's language assets and deficits in order to guide treatment and management, to infer the location and etiology of the lesion causing the aphasia. This also facilitates classification of the type of aphasia by using a table developed during standardization of the original edition of the Western Aphasia Battery. Identifying the type and severity of aphasia enables the evaluator to provide a clinically relevant baseline for research, diagnosis, and prognosis. The oral-verbal section of the Western Aphasia Battery contains spontaneous speech, auditory comprehension, repetition and naming, and word finding, and can be administered in approximately 45 minutes. The reading, writing, apraxia, constructional, visuospatial, and calculation, along with supplemental writing and reading sections, can be administered in 45 to 60 minutes. The bedside Western Aphasia Battery can be administered in 15 minutes.
All right, Mrs. Gilchrist, I'm just going to ask you a few questions about your son, Ryan, okay?
Okay.
So first, how has Ryan's demeanor changed, if at all, since his stroke?
He's still really friendly. He has a good sense of humor. Um, but he doesn't go out as often with his friends, and even his friends, I think, haven't been coming around as much. So he's been staying home a lot, and which is not normal for him. He likes to go out and be out and about.
Okay. As far as communication, what would you like to see Ryan accomplish with therapy?
Well, just like we were saying with his friends and stuff like that, I'd love for him to get out more even now, but ultimately, he's young, so I'd like to see him be able to communicate enough to be able to get back to work and things like that. I feel like he's, almost been a little bit sad just being at home a lot.
Okay. Um, and is Ryan currently using any strategies at home to make communication easier?
Um, if he can't think of what to say, he'll sometimes point or like gesture or something like that towards something.
Okay. And what is the speech pathologist working on with Ryan during therapy at Marymount Hospital?
They're really working on getting him to just talk more, but sometimes I feel like a couple different things. Sometimes I don't think he always understands what they're asking of him, and some of the stuff I sometimes feel like is a little kid, like almost a little bit immature for where he is.
Okay. Well, what types of activities or subjects does Ryan enjoy?
He's big into sports, basketball especially. He likes to play basketball. He played video games and stuff with his friends. He still does that a little bit, but it's hard with him not having a lot of feeling in his right side. Um, Otherwise, like reading the newspaper, he likes to keep up on like the financial, side of things.
Okay. Perfect. We are going to go ahead and get started with Ryan then, if that's okay.
All right, thank you.
Western Aphasia Battery Subtest, Part 1, Aphasia Quotient, Oral and Verbal. Spontaneous speech. The tasks in this section elicit conversational speech from a patient to measure functional communication, information content, speech fluency, lexical access, paraphasias, and grammatical competence.
Okay, Ryan, we're going to start by, I'm just going to ask you a few questions, okay?
Okay.
First, how are you today?
Good.
Have you ever been here before?
No.
What is your first and last name?
Ryan. Uh, I know this. Um, mm,
What is your full address?
so what?
Street.
Um, uh, uh, Ohio.
Okay. And what is your occupation?
Um, uh, like, I know this. Um,
That's okay.
mm,
Why are you here?
I had stroke. Uh, Talking.
All right, now I'm going to have you just tell me what is happening in this picture. Just a few sentences.
Um, uh, the dog. What? What? Doy. No. He playing. Um. Read book. I can't.
Okay, that's good.
Auditory verbal comprehension is related to many cognitive operations in the brain: phonological perception, central auditory processing, short-term memory, lexical access, semantic memory, etc. These tasks will measure a person's auditory verbal comprehension of sentences with relational prepositions and increasingly complex grammatical constructions, single nouns in different categories, and sentences of increasing length.
I'm going to ask you some questions. Just answer yes or no. Is your name Smith?
No.
Do you live in Cleveland?
Yes.
Are you a doctor?
No.
Does March come before June?
No.
Is a horse larger than a dog?
No.
And do you cut the grass with an axe?
Yes.
So I need you to point to the cup. Okay, now on here, show me the comb. Point to the square. And show me blue. And then can you point to your eye? And then can you show me your left elbow? Ryan, I'm going to ask you to do some things. Are you ready?
Mm-hmm.
Okay. Raise your hand. Shut your eyes. Point to the chair. See the pen, the comb, and the book? I will ask you to point to them or do things with them. Are you ready? Point to the pen and the book. Point with the pen to the book. And put the pen on top of the book and give them to me.
Repetition is a key component when analyzing a differential diagnosis for types of aphasia. The purpose of repetition tasks is to examine phonological processing, auditory short-term memory, and working memory. The tasks included in this subtest of the Western Aphasia Battery require the testee to repeat high-frequency single words of increasing length and complexity, compound words, numbers, number-word combinations, high and low probability sentences, and sentences of increasing length and grammatical complexity. The evaluator should know any phonemic substitutions, instances of stuttering, repetitions, segmentations, dysprosody, and other features of verbal apraxia. When administering this subtest, the stimulus may be repeated once, but only on the patient's request or if the patient appears not to have heard the stimulus. Do not repeat the stimulus if the patient's answer was incorrect. If a phonemic paraphasia occurs in a consonant cluster, example, frexy for freshly, and alters both phonemes, scored as a single paraphasia. Do not deduct points for an articulatory error due to dysarthria.
Repeat these words. Say pipe,
Pipe.
banana,
Banana.
45,
For live.
95%,
9 cent.
delicious freshly baked bread,
Break bed.
pack my box with 5 dozen jugs of liquid detergent,
Back my box.
Naming is a key component in establishing the severity of aphasia rather than a differential diagnosis, except when diagnosing anomic aphasia. All aphasics are generally poor with naming tasks. In this task, the patient must name common objects from various categories. Deficits in confrontational naming, the ability to name objects that are visually presented, may reflect an impairment of lexical access to words or to the actual loss of semantic codes. Word fluency also evaluates lexical access as well as executive function and frontal systems function. In this task, the patient must name as many animals as he or she can in 1 minute. The semantic component to word fluency in the Western Aphasia Battery, animal naming, is important in aphasia testing because it allows the clinician to explore lexical access more than phonological fluency or naming words that begin with certain phonemes such as F, A, or S.
What is this object?
Ball.
And what is this? Ham.
Hamlet.
And then what is this? A screw. And what is this?
T.
And what is this?
Rubber pan.
And then what is the name of this object?
Fork.
Name as many animals as you can in 1 minute. Think of a domestic animal like the horse or a wild animal like the tiger. Whenever you're ready, you can start.
Pig. Cat. Dog. Bird. Cow. Lion. Elephant. Deer. Raccoon. Snake.
Word finding sentence completion evaluates word finding in context. In this task, the patient must complete 5 orally presented sentences. This is most useful in the evaluation of severely affected aphasics, as this may be the only word finding ability they have left. A severe deficit is present in those that lose the ability to complete sentences, specifically those sentences that are automatic or overlearned sentences or sayings. In the responsive speech task, the patient must respond verbally to 5 simple questions. This may be the most difficult task because the responses are less automatic and represent a slightly higher level of word finding.
Complete what I say. For example, ice is.
Cold.
The grass is.
Gray.
Sugar is.
Good.
Roses are red, violets are.
Boo.
They fought like cats and.
Dogs.
Christmas is in the month of.
Winter.
Now, answer the following questions. What do you write with?
Pen.
What color is snow?
White.
How many days are in a week?
11.
Where do nurses work?
ER.
And where can you get stamps?
Mail.
Ryan scored on the aphasia quotient 47.1 out of 100. That's made up of the spontaneous speech score 7 out of 20, the auditory verbal comprehension score of 7.65 out of 10, the repetition score of 3.8 out of 10, and naming and word finding score of 4.1 out of 10. Ryan's scores do put him under severe Broca's aphasia and a severe apraxia rating. Thanks for watching.
We hope that this video was informative and helped you to gain a better understanding of the Western Aphasia Battery Revised.